Regional leaders and health experts gathered in Saint Lucia to confront two of the Caribbean's most pressing public health challenges, non-communicable diseases and mental health. The Caribbean Regional Technical Workshop on Tackling NCDs and Mental Health was held on Monday, June 23rd in Castries. The event brought together policymakers, health professionals, and international partners to address what many describe as a silent epidemic sweeping across the region. Honorable Moses Baptiste, Minister for Health, Wellness and Elderly Affairs, in his closing remarks, emphasized the significant impact that non-communicable diseases have had on Saint Lucia.
We know that NCDs remain the leading cause of death worldwide, and this is also true for the Caribbean. As you've heard before, an estimated 75 to 80% of deaths are due to NCDs. The findings from the most recent population-based World Health Organization stepwise approach to NCD Risk Factor Surveillance Survey, or STEPS, in 2020 concluded that from a representative sample of the Saint Lucian population aged 18 to 69 years old, 65% were overweight or obese. 65%. 46.1% females and 20.6% of males were obese.
The health minister further outlined the government's ongoing initiatives aimed at addressing the escalating challenge posed by non-communicable diseases.
Through the Universal Health Coverage Initiative, NCDs such as hypertension, diabetes, and cancers are included within the essential package of health services. These services include screening and treatment for hypertension and diabetes under the current performance-based financing pilot project. Breast cancer screening, HPV testing, and prostate cancer screening are part of the services under men's health services and other services that have been developed through the Universal Health Coverage Unit.
Baptiste also emphasized the range of services provided through universal health coverage aimed at addressing non-communicable diseases.
We launched new services for breast cancer screening. And in Saint Lucia today, anybody who wants services in breast cancer screening can go to the Wellness Center. We have, through the World Bank, through the generous contribution of the World Bank, we purchased 2 brand new mammography machines and installed them at 2 of our hospitals so our people can get services at no cost to them. And if there are additional investigations, biopsies, and so on, the government will also pay for these services. So, no cost.
As the government advances its efforts to provide universal health coverage, which will support the treatment of NCDs and mental health, the health minister spoke on the timely nature of the workshop, emphasizing the need for a cultural shift towards healthier eating habits as a key step in combating non-communicable diseases.
Today's workshop, therefore, is very timely, leveraging primary health care and this network approach to tackle NCDs and mental health in the Caribbean. It's very timely because we need to find not only multi-sectoral approaches, but we need to find ways to cause Caribbean culture over time to move towards better lifestyles and better health.
With a growing number of Caribbean citizens affected by chronic illnesses and mental health issues, the workshop signals a renewed regional commitment to turning talk into action. Organizers say follow-up consultations and policy recommendations will be shared with CARICOM heads in the upcoming months. For Choice News Now, I am Direct Lionel.